A few years ago, these dancers could barely move or speak. Today, it's hard to tell they all had a stroke. For most stroke patients, insurance only covers a limited amount of therapy, which meant in many cases, they could not afford to get better. No insurance left piano teacher Mary Katabwe speechless.
It had run out 6 months after the first stroke, probably $300 for a section, and that's too much.
Janice Rodriguez's insured therapy didn't even last that long.
You might get maybe 6 weeks, and believe me, that's just not enough.
Healing a stroke-damaged brain takes time and expensive therapy.
The brain continues to rewire itself for an indefinite period of time, but insurance doesn't see it that way. They cut out. I know, the family knows, the person knows, they have a lot of improvement to make, but how are we going to pay for it?
Speech pathologist Darlene Williamson knew she could help patients talk with more therapy, so she created the nonprofit Stroke Comback Center, got private funding, and works with any patient when their benefits run out.
Well, now I can pick up the phone and say, yes, we can help your family member, and if you can't pay for it, that's okay.
Hi. Just calling to let you know.
And if you want to see what a little extra therapy will achieve, well, this is patient Mary Ross without some high-tech assistance. Seeing the words helps you say them.
Yes, good.
But if you didn't see the words, it would be kind of
hard,
Right.
yes. Frustrated. Take care.
Try not to anticipate what you
Yes,
think it's going to say.
I know.
Okay, we're going to do this one again.
Like so many
We're
stroke
gonna turn it
patients,
down.
Mary Ross has aphasia. Her damaged brain cells can't send the words she's thinking to her lips. The Stroke Comeback Center invented a device that works on mobile devices or computers. A therapist reads a script using slow, careful mouth movements, and the individual speaks with the coach's lips. Suddenly, Mary goes from this,
Encourage and try it.
to this.
I was lost, and now I live alone. I am able to walk for exercise. I cook my own meals and love to travel.
One of the treatment techniques is watch what I say, listen, follow me, you try to do what I'm doing.
Telephone.
Okay, you hit it.
Speech pathologists do it live, face-to-face.
Okay.
But it takes repetition, 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 repetition.
And it takes money many patients don't have. Putting this on a mobile device gives Mary a speech therapist anytime she'd like, for very little cost.
One day I couldn't use this hand, but now I can. When I played the piano, I would just...
2 strokes left former piano teacher Mary Katabwe speechless, and therapists told her that's as good as she'd get because she couldn't afford more therapy. The Stroke Comeback Center helped her anyway.
It brought my smile back, and I thought I was the only one in the whole world that had aphasia. And then I am surrounded with aphasia. I couldn't play on the team because I was a girl.
Mary's coach helps her with writing therapy, video assists, group sessions, essays. Whatever technique works, they use it.
There's not one right approach for each person. There's a saying, different strokes for different folks, and there are different solutions for all those different problems too.
Good.
This center might not exist if Janice Rodriguez hadn't had her stroke. She was an attorney who suddenly couldn't talk. Darlene Williamson helped her. Janice quit her legal job and helped Darlene start the center. Janice says aphasia patients don't lose their intelligence, just the ability to speak.
You do feel invisible. People won't talk to you when you can't speak. very well. They will talk to other people around the room, but they will not talk to you.
Does it sound right?
Yeah, it's
And don't look at it, just say it.
A lot of times people think that you're not very smart or you have other problems, and you feel it's awkward for other people to talk to people who have any kind of speech problems.
The group sessions, technology, and creative lower-cost therapy is helping hundreds of stroke patients. The Stroke Comback Center insists they aren't performing miracles, just helping patients rewire their brains and lives. In Vienna, Virginia, I'm Andy Field for My Generation.